Well, cinnamon's not going to hurt you, unless you're taking spoonfuls and you choke on it.
This is On Nutrition, a podcast from Mayo Clinic where we dig into the latest nutrition trends and research to help you understand what's health and what's hype. I'm Tara Schmidt, a registered dietitian with Mayo Clinic in Rochester, Minnesota. This episode, diabetes. But first, we've got a listener question.
Hey Tara, my name is Leah, and I have a question about chia seeds. What are they? Why are they such a big deal? My sister had them in her pantry at her house, and the packaging looked healthy, so then I got a bag next time I went grocery shopping, and I just put it on my yogurt and my oatmeal, but I just don't know why. So why are they important? Are they important? And am I doing this right? Let me know. Thanks.
Hey, Leah. Remember chia pets? Like the terracotta pots shaped like animals or TV characters that could grow into plants with hair? Those seeds are closely related to what we're talking about, except they're not approved for consumption. The kind you buy at the grocery store can be added to your water, smoothies, granola, oatmeal, or yogurt. They're absolutely nutritious and can add a fun texture to your dishes. A chia gel, the seeds mixed with water that they then soak up, can also be used as an egg substitute in baking. Nutritionally, they contain magnesium, fiber, omega-3 fatty acids, and even count as a complete protein. So sprinkle away and enjoy. A serving is about 2 tablespoons. Chia! Got a question or nutrition trend you want me to unpack? Send us a voicemail at 507-538-6272. I'd love to hear what strange or new ideas you've come across. Now, on to the show. About 12% of the U.S. population has some form of diabetes, with 1.2 million more people getting diagnosed each year. The risk of developing diabetes increases as you age too, especially combined with other elements like lifestyle and pregnancy. What can be done to prevent it? Is it reversible? And does a diabetes diagnosis mean you need to cut out sugar completely? Here to explain is my colleague Gina Wimmer, a registered dietitian and certified diabetes care and education specialist at Mayo Clinic in Rochester, Minnesota. Gina counsels people with diabetes and prediabetes on how to eat well and live well, even with their diagnosis. Hi, Gina. Thank you for being with me today on the podcast.
Thanks, Tara. I'm excited to be here.
Well, we have lots to learn about. Starting with, I think that most people think that there is just type 1 diabetes and type 2, but there are actually quite a few types. Can you explain the differences between them?
So certainly type 2 diabetes, that's the most common, right? 90 to 95% of the population that has diabetes has type 2. The majority of the individuals that have diabetes have type 2 diabetes. And that's what kind of that prediabetes would lead into is type 2 diabetes. Type 1 diabetes, that's more of that autoimmune. Type 1 is going to be found in about 5 to 10% of the population. Now we're seeing it more in adults. And there's another almost classification within that type 1 that's called LADA, and that stands for latent autoimmune diabetes in adults. And you might even hear that classified as diabetes 1.5.
Yes.
But that's really classified under that type 1 diabetes because eventually they're going to have to be on insulin completely. The other types would be gestational diabetes. So in pregnant women, they will be screened for gestational diabetes around 24 to 28 weeks. Gestational diabetes occurs in 2 to 10% of pregnancies in the U.S. annually. So again, much smaller, right? So I'm kind of going in descending order. The next classification is just kind of like other diabetes. So you're going to see, diabetes called by monogenic diabetes syndrome or a disease of the pancreas or drug or chemical induced diabetes. That's kind of more in that 1 to maybe 5%.
And let's talk about risk, because sometimes I think with diabetes, people get blamed, like they caused it, right, by some of their lifestyle choices. And we're absolutely going to talk about lifestyle today, I'm sure. But let's talk about some of the risk factors and even things like genetics.
So if we start with type 1, a first-degree relative is going to put you at greater risk for developing type 1 diabetes. There's no way for type 1 right now that we know of to prevent it from happening. Type 2 is going to be kind of genetic, right? So like if you have a family member, you could be at greater risk. If you were above a certain body weight at birth, you're going to be at greater risk.
Oh, even at birth, like big babies?
Big babies, yeah.
Wow.
Then you're going to look lifestyle too, right? As far as eating habits, physical activity, kind of where the weight is, that kind of thing. And then with gestational, that's really age. So with gestational, 25 years or older, put you at greater risk.
Gosh.
Right, I know.
Okay.
Like how many people are having
Wait,
babies
we're
less than
supposed to be younger than that?
A history of you yourself having gestational diabetes or family members having diabetes put you at a little greater risk. Excessive weight, either going into pregnancy or throughout pregnancy, right?
Mm-hmm.
So you gained a lot of weight during pregnancy. And then race as well has a higher risk factor. So certain races. Genetics can play a role in all types of diabetes, whereas environment is more so a factor in type 2 and gestational. I would say it's more of African American, your Native American, Asian population tend to be at a little greater risk.
Okay. What are the symptoms that indicate someone may be developing diabetes?
I think about that frequent urination, right? And that can go either with type 1 or type 2. But I think with type 2, it's going to be more, you're getting up a few times during the night. Whereas, type 1s, kiddos, they're going to be possibly wetting the bed, right? Because it's just going to be so frequent for them. Thirst, the older we get, we kind of start to lose that sensation of thirst, but they might find, geez, I'm thirsty a little bit more often. Hunger, we're just hungry more often. Again, probably a little bit more of the type 1. I'm eating, but I'm losing weight here because we see that a lot more common with type 1, but I can still see it with type 2s as well. Again, it kind of depends on how long they've had diabetes, because that's the thing. Like with type 2, it can go a long time without us really knowing. That blurred vision, irritability, that unintentional weight loss, all of those things can kind of go together. Even with that gestational diabetes, we really emphasize to those individuals, it's not like you woke up and you were feeling any different now that you have gestational diabetes. They feel no different at all.
You already feel like crap. You're pregnant, so we don't need any more symptoms added to the list. Or you're glowing and I'm happy for you.
I would say if you have any of these symptoms, you should probably have them checked out sooner rather than later.
What about any signs or symptoms of type 2 diabetes? Would the layperson know this without getting their blood sugar checked?
Again, even with them, we might see some of those signs or symptoms. They're much more mild than what we would see with a type 1 diagnosis. So kind of that frequent urination, maybe some fatigue, maybe they had a cut and it's not healing quite like they had experienced in the past. Those might be signs and symptoms.
And there's a lot of numbers when it comes to diabetes. So let's start with blood sugar. So this is when someone either pricks their finger, right, or maybe they're wearing a pump. They're looking at a single point in time. What is your blood sugar right now? Is that accurate to say?
It's kind of, yes, what is your blood sugar level at a certain point in time? Also, interestingly, if you're going to take an intravenous, so you go to the lab and they're going to draw your blood out, that number is going to be slightly different than a finger poke.
Oh,
yeah.
I don't think I knew that.
Yeah.
And then when we talk about A1C, we might hear A1C, hemoglobin A1C, glycosylated hemoglobin. Did I say that right?
Yeah.
That is a longer term snapshot of your blood sugar averages, yes?
Right. Yes, for sure. It's going to give us a better picture of, what has those blood sugars been like over the last 2 to 3 months.
And is that how you would truly diagnose someone? So we're diagnosing people based on an A1C, not on a one-time blood sugar reading.
Actually, both. You could diagnose somebody with a one-time blood sugar. Okay. So normal blood sugar is going to be 70 to 100. If you're 100 to 125, that puts you in the pre-diabetes classification. If you're 126 or higher, that puts you into the diabetes classification. But oftentimes, what I see anyway, is if someone has an elevated blood sugar, oftentimes the doctor is going to draw an A1C just to really get a better idea as far as what that blood sugar has been like over the last 2 to 3 months.
Right. So it's all about a longer term trend. A blood sugar of 126 or higher after 2 separate readings is going to be classified as diabetes. But before it reaches that point, let's talk about prediabetes because it's a fairly common diagnosis. It can be pretty scary for people. They might jump to thinking about insulin or getting their finger pricked, etc. How do you describe prediabetes to someone? Is it reversible?
So they could stay in that prediabetes phase. It depends on how old they are. There's when we're seeing that. So the older that they are, we don't have as many years maybe for that to progress. They're younger, and we have a lot of years for that to progress. But again, the more changes that we can do, kind of the better. So, certainly chatting with them about their diet, their food choices, can we improve those? Can we be a little bit more physically active? How can we push that actual diagnosis of diabetes off as long as we can?
If I have a prediabetic A1C and I do my lifestyle changes, if I have excess weight, maybe I lose it, I turn my exercise up, I get my diet in gear, and my next A1C is in the normal range, can I delete prediabetes off of my diagnoses list? Or do I always have that hanging over my head?
You probably always have that hanging over your head. Yeah.
As a risk, maybe we could call it?
Yeah.
Okay.
So, it's almost like a remission.
Let's talk about how the body reacts to low blood sugar, especially when someone has diabetes. What does that look like? What are their symptoms?
A low blood sugar is going to be less than 70 milligrams per deciliter. So again, if they're checking their blood sugar, if they have a continuous glucose monitor that they're looking at that, we do oftentimes, if they have, I'm going to call that a CGM, continuous glucose monitor, we're going to ask them to do a finger poke because that continuous glucose monitor is going to be a little more delayed than a finger poke. Finger poke is going to be a little bit more real time for them. Those symptoms that individuals are initially going to experience could be sweating, shakiness, just kind of weakness, fatigue. Other more severe symptoms could be headache, hunger, slurred speech, drunken behavior, and even unconsciousness can happen. But again, we're going to see that more with individuals that are taking insulin for their diabetes.
Is there a relationship between diabetes and the brain?
So diabetes can damage or affect those blood vessels in the brain, and so it can cause stroke or memory loss. This can lead to problems with memory and learning, mood shifts, weight gain, hormonal changes. Over time, it can lead to other serious problems like Alzheimer's disease. Both high and low blood sugars can cause these issues. And that's why it's important for people with diabetes to keep their blood sugar within a healthy range.
And so you're talking more about the extremes of highs and lows, not our normal daily fluctuations.
Right, exactly. Yeah.
When we compare those fluctuations in people without diabetes versus people with diabetes, is it more so the risk or is it more so a wider range? How does blood sugar fluctuation differ in someone with and without diabetes?
Yeah. So for everyone, carbohydrate is that first source of energy. It's our brain food, right? So it's going to be that first thing that turns into sugar in the bloodstream. It then moves into the cells with the help of insulin. So a lot of times we talk about insulin is that key to help glucose get into your cells. So in individuals with diabetes, their body does not produce enough insulin. So kind of think type 1, they don't produce any insulin, right? The sugar then remains in the bloodstream. And so that's why we see those higher blood sugars.
Now, one of my personal goals for our time together is to make sure that people are not fearful of carbohydrates because, yes, they cause the blood sugar to rise, but we're not talking just about candy bars and cupcakes. Some carbs, especially those that are rich in fiber, can actually help balance our blood sugar. So what are some sources of healthier carbs?
And that's unfortunately sometimes when I see patients, they're like, oh, I eat carbohydrate and my blood sugars go up. So I've just stopped eating carbohydrate. Well, we can't survive off of not eating carbohydrate. But yes, there's so many healthy carbohydrates. And, those good healthy carbohydrates, they're going to have a little bit more fiber in them. So things like those whole grains. So even like rice, so brown rice instead of your white rice, or maybe wild rice is going to be a better choice for you. Whole wheat pasta, cereals, your bran, your oats, your wheat, those are all really great. And even those black beans, pinto beans, garbanzo beans, those are all really healthy. They're a source of protein.
Yes.
They are going to have some carbohydrate in, but they're also a great source of fiber. So that's really good too. Those starchy vegetables. So there are those few vegetables that tend to be starchy, like corn, peas, potatoes, winter squash. Again, I don't tell people they can't eat them. Incorporate them, but in smaller amounts. Eat the skin on your potato. That's where all the fiber is. Fruit-wise, any of your whole fruits, I'm going to definitely encourage. A lot of times people have some misconceptions with fruit. Oh, I can't eat this fruit because it's going to affect my blood sugar. Well, all fruit will affect your blood sugar. Again, it's the portion size, the quantity. I'm kind of not a huge fan of fruit juice just because there's not the fiber in there. I'd rather individuals eat the whole fruit. And then even like milk. Sometimes milk gets a bad rap. So milk is going to have carbohydrate in. It's lactose, that natural sugar that we find in milk. It's good and healthy for you. Trying to choose low fat versus the whole milk, though, again, the fat content is what's different. And then we think about your yogurt, right? That's Greek yogurt. It's going to have some protein, some healthy carbohydrate in. So again, trying to be mindful about that fiber that we find in those foods. A lot of those carbohydrate-rich foods are really good and healthy for us.
And pairing those carbohydrate-rich foods with sources of other nutrients like protein or with a little fat or with fiber, like you've mentioned, and not just having a bowl of pasta.
Right. Exactly.
Let's talk about how fiber plays a role. So when I'm eating a carbohydrate with or one without fiber, how would that change the impact on my blood sugar?
So foods that have a higher fiber content take longer to digest. So you're going to see more of a gradual rise in the blood sugar than a food item that has no fiber in it. You might see a really sharp peak with that. So thinking like rice, right? A lot of times people are like, white rice just shoots my blood sugars right up there. And yeah, it can because it's very low in dietary fiber.
So carbs, especially the ones that aren't as rich in nutrients, can increase blood sugar levels. Do other macronutrients like protein or fat also cause the blood sugar to rise?
So yeah, it is mainly that carbohydrate. So it's not to say that protein doesn't affect blood sugars because yeah, there's probably about 40 to 50, maybe even 60% of that turns into sugar in the digestion process, but it takes a lot longer. When we think about fats, a high fat diet, fats don't turn into sugar, but fats slow that digestion process down. So that's why for some individuals, especially if they're taking insulin, trying to match that insulin with their rise in carbohydrates sometimes can be very challenging if they're eating a high fat diet.
I'm hearing this is a simple factor of time, right? After a meal, your blood sugar will gradually get back into the normal range. I'm hearing this may be a factor of insulin that you've given yourself or insulin that your own pancreas is making. The other one I thought of was exercise. Can exercise help to decrease your blood sugar? Is that true?
Oh, yeah, definitely. Definitely. Exercise can be as impactful or helpful for the blood sugars as a medication. But individuals that take insulin or other medications that can lower their blood sugar, they might want to be a little bit more mindful about what they're doing. So again, if it's a planned activity, we can take steps prior to that to prevent that low from happening. But if it's an unexpected one, then we might need to eat a little carbohydrate so we don't have that low.
You want the best for your child. K-12 can help them gain the skills they need to reach their full potential while giving you the support you need to get them there. K-12-powered schools are tuition-free, accredited online public schools for students in kindergarten through 12th grade. Their state-certified teachers make online learning interactive and engaging, allowing your child to learn at their pace from the safety of home. Join the more than 3 million families who have chosen K-12. Go to k12.com/podcast today to learn more. That's k12.com/podcast.
So there are multiple kinds of diabetes, and type 2 is the most common. It's when the body's cells resist the normally effective insulin that your pancreas makes, causing a buildup of glucose or blood sugar. Then there's type 1, which is an autoimmune disease that's usually identified in childhood, though a small number of people have a form called LADA, late autoimmune diabetes in adults, or type 1.5. Gestational diabetes can happen during pregnancy and can develop into type 2 later in life. And then there's prediabetes, a diagnosis which can also lead to type 2. While lifestyle and environment are a factor, a lot of it's just due to genetics. So what is in your control? Your blood sugar, indicated by your A1C levels, that's a snapshot of the last 2 to 3 months. Carbs cause blood sugar to rise, but fiber can slow the rise and balance it out. So fiber-rich carbohydrates are your best friends. Try to target whole grains, fruits, vegetables, and beans. And exercise can be just as effective as medication at lowering blood sugar. Why does blood sugar matter for people with diabetes? In the short term, having a low episode can cause shakiness, sweating, and fatigue. But long-term, big fluctuations in blood sugar can lead to stroke, memory loss, and Alzheimer's disease. Now let's talk about managing blood sugar and the nuances of living with a diabetes diagnosis. Gina, will you play true or false with me?
Yes.
All right, let's do it. Okay, number 1. Eating too many sweets can eventually cause diabetes.
False. Eating too many sweets does not cause diabetes, although eating too many sweets could cause weight gain, and weight gain could lead to prediabetes, to type 2 diabetes. They don't need to avoid sugar, but they need to be mindful about quantity and portion size.
Maybe limit is the more appropriate word than avoid. Okay. People with diabetes cannot drink alcohol.
False. They can drink alcohol. With a type 1, they are a little greater risk of having a low blood sugar with alcohol. Kind of the perfect storm would be, I had lunch and now it's 5 o'clock and dinner's not till 7. I'm going to have a few drinks. That alcohol could cause the liver, which is always producing a little bit of sugar, to stop doing that. And that's where that dip in blood sugar could happen. As far as for everyone else, it's going to be the same recommendation that we would give to anyone. So no more than 1 drink per day for women and no more than 1 drink per day for men after the age of 65 and no more than 2 drinks prior to that.
Let's talk about why alcohol is an issue for people with type 1. Because when your liver's metabolizing the alcohol, it's focused on, like, hey, we have a toxin here, we have to do something about that. So it's not really doing its normal side job of helping you to manage your blood sugar. So blood sugar could go down. But what's even more confusing is because some of the symptoms of having an extremely low or even extremely high blood sugar can look similar to symptoms of intoxication.
Right. It's probably more that low, I would say, more often than not. So yeah, I oftentimes tell individuals, okay, if you're going to go out for drinks, make sure who you're with knows that you have diabetes.
Yes. And eat a piece of pizza before.
Or
during. Go get a burrito like a normal college kid. True or false, type 2 diabetes is reversible?
Yeah. So, there is no cure for type 2 diabetes, but individuals can have remission of diabetes by managing lifestyle, losing weight. But this is very individualized. So I can't say everybody can go into remission. So I would say it's less common than common.
Okay. But with prediabetes,
I think there's a little bit more of a chance there. I do.
True or false, I think we might have answered this one. Increasing fiber intake can help to balance blood sugar.
Yeah, definitely. I feel that it can. It takes longer for that fiber to digest, kind of as I mentioned before. So yeah, fiber can help to balance those blood sugars. The recommended amount of fiber is 14 grams for every 1,000 calories. So if you're consuming a 2,000 calorie diet, then you need 28 grams.
Yes, everyone needs more fiber. Even a cup of oatmeal with 3/4 cup of raspberries can make a difference. All right, and last one. True or false, people with diabetes should stay away from white food like potatoes or rice?
No, so that is false.
Mushrooms, you guys, come on.
Yeah, exactly. So avoiding certain food types will not control your blood sugar. Many foods have carbohydrates, and chances are that You'll eat some of those during your typical day, some type of carbohydrate. So this is okay, regardless of the type of carbohydrate. When you choose healthy foods and eat them in proper serving sizes at consistent times, you're doing the best to control your blood sugars. There are many healthy foods, as you mentioned: mushrooms, cauliflower, parsnips, tofu, yogurt. Oversimplifying recommendations with restraints like color, just not a really good idea.
Yeah, it's oversimplifying it, just like you said. We have an argument for all of the oversimplifications of the nutrition world. Let's talk about the rule of 15. So this is something that I have taught people to use to treat a low blood sugar or to treat hypoglycemia. Do you want to walk us through that?
Yeah, sure. So the rule of 15 is you check a blood sugar, you're low. So you're going to treat with 15 grams of carbohydrate. So what that would look like is 4 ounces of juice. This is one time I'm a proponent of juice.
We're okay with juice right now.
Yeah,
You're
exactly.
low.
Or it might be 15 of those little teeny tiny jelly beans or Skittles. But that's a lot to kind of chew. Our preferred method is glucose tablets. So you can buy those at the drugstore. You don't need a prescription to buy them. But one tablet is only 4 grams of carbohydrate. So you really need 4 of them to treat a low blood sugar. So you're going to wait 15 minutes and then check blood sugars again. And so we want to see those blood sugars coming up. They're not in your goal range, then we might have you treat again. And again, do the whole treatment of the 15 minutes, wait and check.
And what I describe to people is kind of this like stair motion of we're treating, we're waiting and checking. We're treating, we're waiting and we're checking. Because I think what sometimes people in a panic, and it absolutely is understandable to do this of, I feel like crap, I know or I believe that my blood sugar is low, let me eat a sandwich, let me chug a soda. Again, with the right intentions, but now we've gone from too low to too high. And then when things do start to kick in, we're crashing back down again. So now instead of this like nice, I'm walking up the stairs, I've gone up the mountain and now I'm sliding back down.
I will always tell people, don't treat with a candy bar. There's too much fat in that. It's going to take too long for those blood sugars to come up. But we also talk about if that low blood sugar is happening in the middle of the night, we might say double treat. So in other words, instead of 15, take 30 grams.
Okay.
Because it's just going to get you to that point quicker. So you're not up for an hour treating a low blood sugar.
Mm-hmm. But again, these are people who have verified with a glucometer or by testing their blood sugar that they are truly low. They're not just going by feeling necessarily, unless you're a seasoned person with diabetes and really know your body well.
And even that, the longer you've had diabetes and the longer you've had low blood sugars, your sensitivity decreases over time.
Okay. Let's talk about some non-nutritional factors and the impact on blood sugar. Because I think we talk a lot about carbs, and of course we talk about exercise, but I also hear about things like illness and stress. How might that impact our blood sugar?
Stress, heat,
Oh,
and humidity. Our sleep, if we're not sleeping well, hydration, illness, infections can all affect the blood sugars. However, they do not affect everyone the same way and are harder to predict an individual's response. So it's not like we say, oh, for stress, you need to do this. Or if you're outside in the heat and humidity, you need to do this. You got to kind of figure yourself out and treat each instance separately.
who is it most important to have really tight control of their blood sugar?
Pregnant women.
I don't know if I would have said that. Excellent. And tell us how that uncontrolled blood sugar may impact both mom and fetus.
With individuals with diabetes, either if they have diabetes, they have type 1 and they get pregnant, we're pretty picky about where we want those blood sugars to be. And we want those blood sugars in goal range. An individual with type 1, we want them 70 to 100. We want them normal. With gestational, we're going to say we want their fasting below 95. And then 2 hours after they eat, 120 or below. Our concerns are that baby is going to get too big. Having blood sugars not in control can cause also hypertension in pregnancy and a greater risk for individuals that have had gestational diabetes in the future to have another pregnancy with gestational diabetes, but also for later in life to potentially have the diagnosis of type 2 diabetes, maybe at preterm birth. So baby might be delivered earlier. So yes, there's certainly concerns, but when we talk to individuals with gestational diabetes in particular, we're just talking about, let's just try to get those blood sugars in control as much as possible. They're going to be contacting their OB very often with what those blood sugars are. If they're out of range, then we might have to add some medication. And most likely that's going to be insulin.
There's no one more motivated than a pregnant person because they are in control of their health, but also their new little human's health. So we find those patients to say, like, I'll do whatever you tell me, right?
Super compliant.
Awesome patients. The risk of developing type 2 diabetes increases with age, right? I think once we hit 45 and older, is there a bump there?
Actually, the diabetes standards of care, they come out every year. So the 2025 ones, 35.
Oh gosh, I feel old. We're supposed to have babies before we're 25. I'm at risk of diabetes. My life is over.
No, Tara, it's not.
I think what scares people a lot with uncontrolled diabetes is the risk of complications. And I start to think of like loss of eyesight and nerve damage in your feet. How do those complications happen?
So yeah, when we think about those complications that can happen, you're totally right. We think about those major organs. So we think about our eyes, we think about our heart, think about our kidneys, think about our feet, the nerves. So that can affect that. For individuals, having high blood sugars over a longer period of time is going to put individuals more at risk. Again, it's that macro and microvascular. So the vessels in our bodies, higher blood sugars can affect those.
Continuous or extended high blood sugar is damaging the blood vessels. So how can we prevent the worst case scenario?
So things that we can do to kind of help with that is certainly managing those blood sugars as best we can. Again, long-term health, thinking about tracking blood sugars can be helpful. Taking medications if they're prescribed. Think about eating a healthy diet, trying to achieve or maintain a healthy body weight, getting that regular physical activity. Stop smoking if you're a smoker, and kind of see that provider on a regular basis.
Cardiologists, go see that person, and you're doing foot checks.
Definitely.
Diabetes is on the list of one of the leading causes of death in the U.S., but I'm not sure we see it the same as you died from a heart attack or you unfortunately died from a motor vehicle accident. So what's the correlation there? Why is diabetes on the list?
It's often due to that uncontrolled diabetes that we just talked about because of the damage it can do to those blood vessels, because that increases our risk for cardiovascular disease, stroke, and kidney disease. So it's kind of almost interrelated there. Individuals with diabetes are twice as likely to have a stroke as someone that doesn't.
Okay, so they're leading to some of the causes of death that are higher up on the list, potentially. So let's clear the air. You don't need to avoid sugar to avoid diabetes, though eating a lot of sweets can lead to weight gain, which is a factor in prediabetes and type 2. People with diabetes can drink alcohol, though it could cause a dip in blood sugar for people with type 1. The best practice for people with type 1 is to eat beforehand and tell your drinking buddies what to look for if you have a low blood sugar. Unfortunately, type 2 diabetes is not reversible, but it is possible for some people to go into remission with weight loss, diet, and exercise. And contrary to popular belief, white food is not the enemy. People with diabetes can eat plenty of quote-unquote white foods like mushrooms, yogurt, and parsnips. But of course, processed foods like white bread and foods with added sugar should probably be swapped out for something more nutrient-dense. Again, the most important factor is blood sugar. If you have diabetes and experience low blood sugar, apply the rule of 15. 15 grams of carbs like juice, glucose tabs, or some easy-to-eat candy, and check again after 15 minutes. If it's nighttime, eat 30 grams of carbs so you don't have to keep waking up to check. Because higher blood sugar damages blood vessels, uncontrolled diabetes can lead to complications like loss of eyesight and nerve damage. It can also be linked to cardiovascular disease, stroke, and kidney disease. But you can prevent those extreme scenarios by not smoking, taking your medications, and seeing your provider regularly. Remember, diabetes is not a death sentence. There are plenty of medications and treatment pathways out there. So let's get into how to live a lovely life despite a diagnosis. When someone enters your office with a new diagnosis of diabetes, what are some of the pieces of advice you give them about living with diabetes?
Firstly, I say, I'm not the enemy. I'm not the food police.
I'm your friend. I'm your friendly neighborhood dietitian.
I think that education, the sooner the better that we can provide that. Sometimes people feel like, oh, I'm doing something wrong. They're sending me to the dietitian. It's like,
oh yeah,
no, it's so not that. We're going to really just talk about them, how the food that they're eating can impact their life and their lifestyle, and take a stepped approach. So I'm going to start probably more with a plate method. So thinking about how we put our food on our plate. Half of our plate is those non-starchy vegetables. We want a quarter of the plate to be that protein. So whether it's fish or chicken, beef or pork, cheese, eggs, that's your protein sources. And then a quarter of your plate to be that starch or that grain component, the beans kind of thing. They can fit into that category. Certainly can have some fresh fruit, some milk. So again, that's what we kind of paint that picture, and giving them visuals and kind of helping them with quantity or portion size. And, like I said, if we have to take a teeny tiny baby steps, but if we can do that over time, it can make a big impact.
Are there foods that you feel like people need to avoid, or foods that are beneficial that we haven't talked about yet?
I'm probably never going to say there's a food to avoid. I probably would say, maybe regularly sweetened items like sodas, just because there's so much sugar in that. Limit your quantity, limit your portion size. Let's see if we can make just some healthier food choices throughout the day. As far as, is there any magic bullet food that's going to help your blood sugar? No, not really. You see, like in the media, maybe cinnamon. Well, a lot of times I look at that and go, oh, well, cinnamon's not going to hurt you, unless you're taking spoonfuls and you choke on it. So, sure, have more cinnamon. The studies aren't backing it up that it's really going to impact blood sugars a ton.
I feel like there can be a bit of a social stigma associated with a diabetes diagnosis. How can patients combat that?
Yeah, there certainly is, right? It's a full-time job to have diabetes. The most important thing is education, right? For those individuals, it's hard to say, you need to educate everyone else. I think we as a society need to educate more about what diabetes is, because individuals feel judged. We have to just be so careful with our words when we speak with them in terms of thinking about just that support and, again, empathy, and trying to understand a little bit where they are at. I don't really watch a whole lot of TV, but I caught this ad a couple weeks ago, and it was this individual that had the diagnosis of diabetes type 2. And he went into his doctor, and the doctor said, we're not meeting your goals. So he got this little Post-it note put on him, right? On not meeting goals. And then he goes home and he's sitting at the dinner table with his wife and family. And she's like, did you check your blood sugars? Check blood sugars. And then the next scene is this guy with these Post-it notes all over him, right? And I'm just like, yeah, it's a lot of work. It's a lot to think about. Diabetes is tough.
That's a great analogy. It's a full-time job. It's a chronic illness.
Right. And when I work with our diabetes nurse educators and we teach some of our classes, they have a really great picture. It's like a circle, right? And it's got this little teeny tiny sliver. And they tell individuals that little sliver is how much time you spend with your healthcare providers. The rest of the time is all you.
Yeah. I have a feeling people ask you about keto, though. So high fat, low carb. Is this a good option for people with diabetes?
No. That's my personal opinion. There is a risk for, again, that oversimplification. Let me just take carbohydrate out. really a true keto approach. Initially, it was designed to help individuals with seizures. So keto, in my eyes, it's not sustainable. And yeah, certainly individuals can lose weight with keto.
Mhm.
But again, because it's not sustainable, oftentimes they're going to go back to kind of those old habits and the weight's going to come back on. Blood sugars are going to go up again. So again, it's really not a healthy diet. It's a lot of fat, and it should be more unsaturated fat. But for a lot of individuals, it's more saturated fat. So not going to be heart healthy for them. Again, for people with diabetes, we really want to think long term, what changes can you make and live with?
Let's get into the spectrum of treatment options for people with diabetes. So in obesity, I kind of like to list them. Well, we start with lifestyle, and then we may go to a medication, perhaps a procedure, and maybe a surgery at the end. With diabetes, I'm thinking fairly similar, but I'm more going from lifestyle to oral agent to insulin to pump.
Depends on the type of diabetes that they have, right? So
Yes,
if it's
you're
type
right.
2, then yes, lifestyle. But it really kind of depends. Sometimes an individual will get diagnosed with type 2 and their A1C will be super high. And then they might start them on insulin right away. And that might just be a temporary thing.
Okay.
Wake that pancreas back up, give it a chance to start producing that insulin maybe a little bit more. And then oftentimes maybe some of those different oral agents to kind of help with that. But yes, in a slow progression, diet and exercise, oral medications, or now we have those GLP-1s. And so that might be an option for individuals. It's really kind of up to the individual and their provider as far as what's going to be the best route to go with that. Some individuals are on several types of oral medications. It really just depends. If they're type 1, it's going to be insulin from the get-go.
Yeah.
And ideally, probably more of an MDI at first so that they know how that works, and then to a pump if they want a pump. But people feel pumps are very intrusive too, right? This is attached to me all the time.
And I'm hearing with type 2 diabetes, it may be a little bit more fluid among that spectrum, right? Then, you can't go back from having a bariatric surgery. But with diabetes, you may be able to go back from being on insulin to an oral agent or a GLP-1, I'm hearing.
Potentially. It really just kind of depends.
Let's talk a little bit more about the impact that exercise can have on blood sugar. So it lowers blood sugar, which is why if you're at risk of having a low blood sugar, like someone in cardiac rehab, we actually make them check their blood sugar before they exercise if they have diabetes, and especially if they're on insulin. Are there some exercises that are better than others? There was a study that said doing 100 squats throughout the day could be better for your blood sugar than taking a 30-minute walk.
So I did look at this study. Interesting is this study was conducted in a very small sample of individuals, 18 participants. So the important guidance is to choose an activity that you enjoy and you can do it on a routine basis. Just get moving.
We've said it 100 times, everyone. I don't care what you do. Just do something that you don't hate.
And if we look at the recommendations by the American Diabetes Association, they suggest 150 minutes of moderate to vigorous aerobic activity spread out throughout the week, right? So sometimes I tell individuals, even if you can do a 10, 15 minute and do that a couple times a day, that's going to get you up there. And then also strength and resistance training 2 to 3 times a week is going to be helpful for those blood sugars.
Gina, thank you so much for bringing all of your knowledge on a topic that has always made me a bit nervous because I feel like there's so much going on here. So I very much appreciate your expertise and your time.
You're welcome. It was fun to spend the time with you, Tara. I just never see you anymore.
It's wonderful to see you. If you get a diabetes diagnosis, the key is being aware. There's no real magic bullet, like cinnamon, to cure your condition. As usual, it comes down to a balanced diet and a lifestyle that involves regular exercise. In addition, there are plenty of resources, like registered dietitians, medications, and devices to help you manage for the long haul. It takes a lot of energy to manage a chronic illness like diabetes, but there's nothing to be scared of. If you're cognizant of your carbs and fueling with fiber, diabetes should be scared of you. That's all for this episode. But if you have a follow-up question, leave us a voicemail at 507-538-6272, and we'll answer it in a future episode. On the next episode of On Nutrition, alcohol.
I have brain fog. No, girl, you drink too much and you doom scrolling on your phone. Get off.
For more On Nutrition episodes and resources, check us out online at mayoclinic.org/onnutrition. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find our show. Thanks for listening. And until next time, eat well and be well.
You want the best for your child. K-12 can help them gain the skills they need to reach their full potential while giving you the support you need to get them there. K-12-powered schools are tuition-free, accredited online public schools for students in kindergarten through 12th grade. Their state-certified teachers make online learning interactive and engaging, allowing your child to learn at their pace from the safety of home. Join the more than 3 million families who have chosen K-12. Go to k12.com/podcast today to learn more. That's k12.com/podcast.
This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.